who was swimming and drowned. And the lifeguard had to pull him out of the water and give some rescue breaths. Are you ready to go? Video is going? Yes. And this boy was lifeless. The lifeguard breathed for him, and he woke up, but he's very confused. And so the lifeguard put him in his car, and he brought him to the hospital. You're in the emergency department. And he's just arrived, and he's just lying on the table. Okay? Okay. Great.
Okay. Com'è quick look? Okay.
Yeah. Quick look. Not moving.
Non si muove?
Not moving.
Non si muove. Ok. Respira? Easy breathing? No.
Take a look. Qua.
Ok. Non sento il polso. Non respira e non si muove.
Ok, ragazzi, così. Allora, si vuole vedere attivo posizione molto come il lastre, al centro place a just la regolazione.
Is that where you're putting? No.
No,
Non vale.
Show me where you're putting it.
yeah, here.
Fagli vedere.
Oh.
It doesn't work. Okay. And I can underline other side here.
Right here?
Yeah.
Oh.
Secondo ciclo.
Analisi del ritmo.
No.
Analisi del ritmo. Asistolia, ritmo non desibillabile. Adrenalina, adrenalina.
Heads off. Heads off.
Terzo ciclo.
Show me where.
Fammi vedere. No.
Here.
Devi efficace.
Ah, yes. Okay.
Quarto ciclo.
I take some blood gases, okay? Blood gases, CDC.
You have to have a syringe.
Per poi la
Devi efficace.
Io se puoi, il manichino e sfoglialo.
Ok.
Blood gases, CDC.
Asciugo il manichino.
Blood gases, CDC.
Okay. The nurse asks you, it's intraosseous blood. Can you send it to the lab?
La mia cosa.
Yeah. I write it down on the lab that is going to process. Okay.
Then I turn la laringe.
Normal synthetic first. Does it work? With normal synthetic? Yeah. Okay. I prefer some adrenaline 1 to 2,000.
The monitor is not showing CPR.
1 milligram, 1 to 10,000. Okay. Then I will give you 2 milliliters of adrenaline 1 to 10,000. Okay, guys? I give you 2 milliliters of adrenaline 1 to 10,000 distributions. Okay, and then 3 milliliters of counter. Okay, adrenaline dump.
Andiamo in continuo solo la laringe.
Ok, abbiamo fatto l'adrenalina, quindi adesso andiamo solo per 1 minuto e 40.
Sì, la motivo.
Fare un sotto soccorso e arrivare
End title is in place. End title.
Okay. Okay, bilateral.
Excuse me, one moment, time out. The mannequin is not working. Can you just fix the mannequin for 1 second?
Okay.
Just time out for 1 second. Pause. We're having a mechanical problem for displaying, so we just need a moment to fix the mannequin. Time out.
We need a sponsor for time.
Nel senso che sto vedendo le vostre impressioni, non vedete il feedback sul...
We're having difficulty displaying the rhythm and the compressions on the monitor. He has to fix this, and then we can resume. So remember where you are in terms of the...
Un minuto e 10.
Il sensore è giusto.
Dai, per quanto da fare?
So while we're having the timeout, can you, the team leader, can you just review what has happened so far? Summarize.
Ok, allora ragazzi abbiamo un paziente con insuficienza cardiaca, che sono non fibrillabile secondario a annegamento. Abbiamo un ritmo non defibrillato quindi senza subire CCD, abbiamo somministrato la prima adrenalina, abbiamo preso una assistente a uso da cui abbiamo fatto la prima adrenalina, ora mettiamo anche un modo di caldi. E a chilo già asciugato del paziente, ascolti i vestiti bagnati e abbiamo girato l'anestesista. Ok? Dobbiamo continuare comunque l'RCP fino a quando comunque non abbiamo posto e assegniamo anche l'arrivo dell'anestesista. Con le raccomandazioni ci dobbiamo anche preparare a stabilizzare meglio le diete. Okay?
Per ora ce l'abbiamo nella legge, lo sto vedendo.
Perfetto. Monitoriamo la filmografia
E abbiamo un'ega per
sì, è quello che vediamo.
And then what did you communicate to the anesthesia?
Allora io ho comunicato che è arrivato un bambino di 5 anni che stava nuotando e sono state fatte le prime manovre di soccorso ed è arrivato confuso e successivamente in arresto cardiaco con sospetta anestesiologia. Al quale abbiamo cominciato nell'animazione con delle cinte di qualità e una prima adrenalina.
And when you're calling anesthesia, what for an SVAR, what do you think they want to hear?
Quando viene l'anestesia, per un'espa, cosa pensi che vogliono sapere?
Il paziente, l'età del paziente, quindi il tempo di paziente, qual è la situazione attuale, cosa è stato fatto e cosa monitorare.
What do they want to know first?
Cosa vogliono sapere prima?
Do you need me now? Do you need me to come now? So you can start the SVAR with, I have a boy in cardiac arrest, I need you to come right now for intubation. Because what they want to know, do I leave my patient in the operating room to come? Or do I have time? You're calling to tell me about a child who I might need to do something on. So you have to be very direct with your consultant. What do you want? What do you need? Now I can tell you why, but what do I need? Okay. Remember, we're good? Okay. So you remember we're 2.5 minutes into the resuscitation. Everybody okay?
Okay.
Okay, wait. Start again. Okay.
Ripartiamo con le recipienti.
You have a freeway routine.
Yes, you can get up there. Freeway routine.
45 secondi
Then I start with
dalla
100 milliliters of warm drinking lactate, okay? I start 200 milliliters of drinking lactate with warm liquid. Okay, right now. Okay, drinking lactate starting. Okay, right? Not now. Okay, se lo partire il volo. Yeah, the last. I've already prepared some adrenaline 100,000 I will on the serum.
Ok, 20 secondi alla rivalutazione.
Siamo ancora. No, però siamo venuti dalla fine.
10 secondi alla rivalutazione, guys. Ok, 4, 3, 2, 1, preparati al
Cambia assistoria, rispondi la vai, continuo.
Okay. What's in the monitor? Okay, we need to check blood test,
Sì?
blood gas, to see if there is
Do we have any blood
then the title is not
Yes, the lab is complaining because the machine is not working very well because it has a lot of the blood glucose is 200. Blood glucose 200. They think the pH is 7.00.
Okay.
The PCO2 is 80. The oxygen is 24 venous blood gas.
Okay.
And the base deficit is minus 20.
Okay.
The sodium is 130. Potassium is 5.0. Yes. And calcium is normal.
Ok, un minuto alla rivalutazione e alla prossima richiamiamo il caso serva.
Sì, allora per iniziare la votazione è arrivato lei, Gabbia che effettivamente aveva un quadro di asciugosi. Vai, nel controllo nemmeno il gruppo senatore.
I put a warm blanket on me, okay?
We need to check the 5T and 5T.
Perfetto.
30 secondi alla rivalutazione. Pupils, sorry. The pupils of the patients, 20 secondi.
Pupils are large and minimally reactive but equal.
Quindi dai grandi temperatura 34, ok, 5 secondi alla rivalutazione. Preparate con la vogliamo fare? Due secondi, vai.
Votazione ritmo. Tacca. Pistolia.
Continuati, allora possiamo fare la seconda adrenalina, dimmi quando la fai.
Yes, about 5 rooms down there's an ultrasound machine. If you want, you can put somebody to make it.
Vai,
Quando andare qualcuno a prenderla in 5 stanze di
Okay. I think all the outside it has to be one of the team
Now we
members.
give you 2 milliliters of adrenaline 1 to 10,000.
Perfetto.
Adrenaline done and then okay, continue. I can go for the ecography, okay?
Yes.
Can you manage?
Yes.
There is a
Yes.
The ultrasound machine is here now. Okay. Take an ultrasound. What do you want to know?
Cosa volete sapere?
We want to know the pericardium, we will see something there are
No
fluids,
effusion.
no infusion, okay.
But it looks like the heart is beating a little bit.
Ok, dai. Non ci fermiamo durante la massa.
Non stop.
La vena cava, collassa.
It's too hard to evaluate. There's too much motion. It's hard to see.
Ok. Due sireni, free fluids in the abdomen? No? Ok. Quindi
The child's starting to move.
The child is
Cough.
Analisi del ritmo.
The response.
Terapia sinusale.
Ok.
Ok.
Prendiamo una pressione. Una pressione. Okay. Vincenzo prepare adrenaline 1 to 100,000. Okay, so we need like the push dose of adrenaline.
Perfetto, benissimo.
Okay. Prendo la pressione. Okay, I give 100,000 and then I later use. Okay, we have adrenaline.
Okay, let's stop there. And now you're the recorder, yes? Why don't you give an S-bar now to anesthesia ICU? Okay, 30 seconds. And if you can look into the camera and give your S-bar, his anesthesia is going to listen.
Okay.
Okay?
Okay. So we have a 5-year-old boy, estimated weight 20 kilos, and now he's in ROSC. He arrived in cardiac arrest after drowning. It was a non-shockable rhythm, and we have done a quality RCP for 7 minutes, 2 adrenaline, 1 bolus of ringer lactate. The blood gas were okay, and also ultrasound, fast was okay. So the recommendations are to check the blood test to support the circulation and the airway management, and to do the secondary assessment.
Great, it sounds like you're doing a good job. I'm busy in the OR. Do you need me now or do you need me to come in 15 minutes?
Now, please.
Okay, great. Good. Excellent. Okay. Apologies for the interruption. As we expected, sometimes we have a problem. Sorry. Okay, so now you go back. We'll have the other team, then we'll have a debrief. Okay? I think of something good and something to improve. Okay? Thank you.
Thank you.
Thank you. 5-year-old boy. who the lifeguard had to pull out of the water. He was in a river and had drowned. The lifeguard pulled him out of the water, gave some rescue breaths, and the boy woke up. But he was very confused and coming in and out of consciousness. So he put him in the back of the car and he drove him nearby to the hospital where you are. You're in the emergency department. And the boy has arrived and been put on the table for you.
Okay.
It's okay? Okay, let's start.
Squadra, abbiamo un bambino di 5 anni, 20 kg, con storia di annegamento. Allora, Tecla Leviere, Giuditta San Circolo, Ceci, Monitor, Sofia, i farmaci e tu Ale stai con me. Allora, stendiamolo, iniziamo a valutarlo, è cosciente il bambino? Guardate se è cosciente, vedi se respira, bambino.
Le vie sono perdi.
È pallido, è marezzato.
He's pale like this.
È marezzato. E il respiro, respira. Guardate se respira. Ok ragazzi, allora questa è la circolazione. Respira. Non respira, allora senti il polso. Non passa. Allora ragazzi iniziamo. Esatto, spineboard, iniziamo a mettere il monitor, siamo di fronte a un arresto da annegamento, iniziamo a fare l'adrenalina, intanto io lo asciugo, sto asciugando.
What are you doing? Drying?
Drying, and I do the
If you remove his clothes, if you're removing.
Controlliamo se si espande il torace, altrimenti
perfetto, e gli metto la coperta.
Si espande? Ok.
Esatto.
Mike
e stabilizzali la coperta antiparta. Trattiamo come un trauma. Metto il collare.
Metti il collare.
No C-collar, there's no C-collar. You don't
Ok, allora mi raccomando non facciamo le manovre per estensione, se deve avere un trauma. Bravissimo. Appena siamo pronti per monitorare, valutiamo il ritmo. Nel frattempo abbiamo una temperatura. Temperatura 34. Perfetto. Va bene. Nel frattempo so che se riesci a prendere l'accesso venoso. Ok. Vai con il prova per monitorare. È pronta per rivalutare, dici quando staccare. Ok, una seconda volta. No. Ok, no, prendo la prossima. Metti la esatto. Siamo unconscious, io sono proceed. Ok, perfetto. Allora,
appena sei pronta ci per la rivalutazione.
Io sono pronta, staccate.
Vai, mettiamo il ritmo.
Siamo di fronte a un arresto cardiocircolatorio dovuto all'annegamento, siamo di fronte a un monodo fibrillabile, falli.
3 centimetri su 2 centimetri sotto la civia tibiale idealmente.
Bravissimo. Benissimo Sofi, appena riesci fai la prima adrenalina.
Vai, sono 2 ml.
Vai.
Inizio a fare l'adrenalina fatta.
L'adrenalina fatta.
Faccio il volo di fisio.
Bravissimo. A quanto serve? Ok. Va bene. Possiamo fare quanto manca?
Tra un minuto di valutazione.
Tra un minuto faremo la rivalutazione. La temperatura sta salendo. No, la temperatura si mettiamo permessi caldi.
Let's add some
Prepariamo intanto Sofi della fisiologica calda.
Okay, let's time out for a moment. Just for a moment. The last team we had a mechanical problem. So what I would like the team leader to do is to summarize where you are now.
Okay.
And I also would like somebody to call anesthesia. We're going to listen to them to call anesthesia. So we're just taking a time out. Time out for a moment to be fair to the other team. Yes. Okay.
Va bene, quindi adesso ragazzi siamo di fronte a uno shock un arresto cardiopolmonare non defibrillabile a seguito di un annegamento. Stiamo facendo la resuscitazione della SIA del CPR, stiamo facendo abbiamo fatto la prima adrenalina, tra un minuto faremo tra 30 secondi faremo la seconda adrenalina. Esatto, il bambino ipotermico lo stiamo scaldando con il copertino abbiamo asciugato, ok? Sta arrivando l'anestesista, ok? Non siamo riusciti a reperire l'accesso venoso, abbiamo l'intraossea, ok? E adesso stiamo per fare poi anche un buon risoluzione fisiologica calda per sperare di tirare su la temperatura.
Okay. Now, who would you have call anesthesia?
Quindi ora ti chiamano l'anestetista.
Okay. Okay. So
I'm gonna call right here.
30 seconds. You have 30 seconds to call anesthesia.
Hai 30 secondi per chiamare l'anestetista.
No.
Right here. Yeah, that's fine.
Okay. So we have a cardiopulmonary arrest in a child of 5 years old, 20 kilos more or less. We're doing CPR. We already performed 1 dose of adrenaline, and we suggest your intervention or your help for further airway access.
Okay, I'm busy in the OR. Do you want me to come now or you want me to come a little later?
As soon as possible.
Okay.
As soon as possible. Thank you.
Okay.
Do you know more or less when will you come?
I will be there in 2 minutes.
Okay, thank you.
Okay. Are you ready? Remember where you are? Remember? Yes.
Okay. Si riprende.
E restart, poi consideriamo l'advance hour nel frattempo. Ok? Allora, dovremmo fare degli esami per escludere ipoglicemia, però abbiamo un'intraossea, quindi abbiamo lavorato nel laboratorio, che arriveranno degli esami che però è da sangue midollare, esatto. Fai l'emogas, per vedere l'emogas, così valutiamo la licenza. Nel frattempo di tips, una point of care da insignia.
It will be back in 1 minute.
Ok, un minuto. Bravo ragazzi, così. Perfetto. Nel frattempo sono fare in volo da 20 ml chilo di soluzione fisiologica che nel frattempo abbiamo scaldato in 20 minuti, per cui 400 ml di soluzione fisiologica calda, ok, messa la fisiologica, ok. Tra 30 secondi avremo la glicemia, brave così ragazze.
Blood glucose is 200. The blood gas also comes back.
Okay.
It's 7.00.
Ok, in acido
80 for the CO2. 80. And oxygen 24 venous.
ok.
Base deficit minus 20. Sodium 130. Potassium 5.0. 5 potassium.
5.3.
And calcium normal.
Ok. Allora abbiamo il potassio ai limiti superiori, Sofi e Mamino anche con una grave stato di anche trattato così di shock, per cui facciamo il volo, adesso stiamo facendo l'alchimia e l'alchimia però probabilmente la stress, ok? L'alchimia ma non lo organizziamo.
Siamo ancora in assisteria a continuare a venire
vicino a Nuova Delhi. Quando posso fare?
30 secondi, se sei pronta.
La temperatura è salita? No. No, siamo ancora poi prepari un altro bollo fisiologica. Ok, dimmi di quale.
Se vuoi, se hai l'adrenalina pesante.
Faccio ancora 2 ml di una soluzione a 10.000
Messa, fatto. Ok, e faccio il modo di fisio. Ok, fatto. Seconda rena fatta. Va bene.
Abbiamo un sintetizzazione di frequenza in
chiamiamo il radiologo per il torace. Facciamo un eco fast. Possiamo fare un eco fast?
The echo is coming over.
Ok, perfetto. Quindi chiamiamo anche il cardiologo. L'anestesista starà arrivando.
The echo machine is here.
Ok, riesci a fare tu che abbiamo ancora un po' di tempo l'addome?
It's hard to see, you don't see any fluid. What are you looking for?
Quindi a livello dei polmoni,
Too much motion, you can't see. But there's no pericardial effusion. And it looks like the heart is beating. It looks like the heart is beating. And then the patient's starting to move.
Si muove il paziente, rivalutiamolo.
Okay, let's stop. Okay. Okay, stop. Alright, now what we're going to do is we're going to go next door. We'll do okay? Okay. See you in a moment.
Thank you.
E la giacca legata?
It's okay, no, we can do that. Let's see. Mike, are you okay to be the grandfather?
Yeah, of course.
So Antonio is here. His grandfather is bringing him in. He's a child who 2 months ago had a kidney injury, kidney problem, and needed dialysis at home. And so he's on home peritoneal dialysis and was doing fine. But this morning, when he woke up, he's complaining that his chest hurts, his belly hurts, and he doesn't want to eat his breakfast. He's very sleepy. And he's just complaining of a lot of belly and chest pain. So his father brought him in to the emergency department at the hospital, and he's here to meet him. And he's 5 years old. 5 years old, yes. And Grandpa is here. Yeah. Give me one moment.
Ok, allora prepariamo il team, quindi Caro Levieri, Marti Farmaci, Eli valutazioni, Andrea al monitor, Vale e mettiamo il GP e ci prepariamo per le valutazioni. Quindi il bimbo è arrivato.
Grandpa.
Oh, is he okay?
Is he okay?
Buongiorno, no, grandfather o father?
Grandfather.
Sia tranquillo, adesso vediamo cosa succede.
The boy is asking to drink some water and wants to sit up because his belly hurts and he feels better if he can sit up.
Allora, possiamo tranquillizzarlo, però in un momento non lo facciamo bene.
I want to drink some water.
Ok, nonno si metta vicino al bimbo, lo tranquillizzi.
And help him to sit up a little bit.
Ok, come il bambino è cosciente, incosciente, è cosciente perché
Yes,
vuole bere.
and he's complaining that he wants some water and he wants to sit up.
Il colorito di questo bimbo?
Yeah, and very swollen. Eyes are swollen, arms are swollen, feet are swollen.
Ok, e il respiro come respira?
40 times a minute. 40 times a minute, and breathing easily but a little fast.
Ok, allora, innanzitutto Andre si mette sul monitoraggio e facciamo con le valutazioni. Martina
He says, Doctora, I want a drink of water.
Ok, adesso ti idratiamo un pochino. Andiamo prima avanti con le valutazioni.
Le vie aeree sono aperte, c'è qualcosa nelle vie aeree?
No, just a little bit of secretions, but
Ok, posso aspirare un pochino le vie aeree? Aspiro.
Ragazzi, è un 78 sinusale.
Ok.
La saturazione è il 98%.
Ok, andiamo avanti. Aspetta Andrea, andiamo avanti prima con la valutazione.
the nurse says that the ECG looks a little irregular. He's complaining of chest pain. He's complaining of chest pain, belly pain.
Let's go on in order with the assessment.
Can I have a drink of water? He wants to know. Please, please, please. Please.
Please, he barely ate this morning. He just drank a little bit this morning. Barely ate.
Allora io direi che il respiro è un pochino aumentato, assistiamolo con un pochino di ossigeno per ridurre un pochino il lavoro respiratorio. Poi andiamo avanti con le valutazioni e andiamo sull'accento.
A 40 di frequenza respiratoria.
Ci stiamo mettendo un pochino di
Oh, I don't want that on.
Now he's getting kind of sleepy. He's getting much more sleepy and not asking for water, not complaining. He says that my chest hurts.
Allora, prendiamo l'accesso.
Prova a prendere un accesso, ci riesco?
Yes.
Ok. Apriamo l'accesso, facciamo intanto esami, EGA, ok? E teniamo anche
You took some blood. It takes about a minute.
Some blood for exam, okay.
You're sending it to the lab right here.
un polso a mettiamo le piastre sopra. No, non siete tranquilla, mettiamo la situazione.
For you. Yeah.
Ok, mettiamo le piastre e quando ci siamo vediamo per la
When we're ready, we should analyze it.
Ok, Andre, quando ci sei,
Glucose is 200. Glycemia 200.
Ah, di glucosio, ok.
Ok, è una fibrillazione ventricolare.
Vado a fare così. Ok. Carica le piastre. 15.
No weight, baby.
Drop up 20 kilos.
22 kilograms.
Carico a 40 50.
The blood gas is back. pH of 7.0. PCO2 50. The potassium is 9. 9.0. Sodium 125.
Allora, nel frattempo che gestiamo il resto ci prepariamo per correggere il potassio. Ok, prepariamo il
Defibrillatore in carica.
Forse è meglio il calciocloruro nell'arresto.
Ok, defibrillatore carico. Da tutti. Clear the patient, ready? Scarico. Ok.
Ok, allora.
Dici quanto manca l'analisi di ritmo?
Sto somministrando 20 mg per chilo di calciocloruro o un flash di soluzione.
The nurse says we have a peripheral IV, and can we give the calcium through the peripheral IV, or do we need a central line?
Ok.
Centrale.
You need it central, so we can't give it peripherally?
We got a peripheral one. No, we can use the one we got now. The peripheral.
So you want to give it?
Yeah.
Calcium chloride in the peripheral IV line that you have now.
Ok.
Sì.
Io mi occupo della rianimazione, faccio il CPR coach.
La plus 10 ml di soluzione fisiologica con flash.
Ok? Quanto ok? Dici dell'adrenalina, ricordaci dell'adrenalina. Ok. per l'analisi del ritmo, solo un po'. Ok? Bravo, Andrea, in questo caso deve prendere una via aerea. Ok, Andrea, quando facciamo l'analisi del ritmo ricordiamoci di scambiarci e cominciamo a analisi del ritmo tra 15 secondi, ok? Vale, quando tu sei lontana da tutto l'anestesista, sì. Ho detto di chiamare l'anestesista non appena abbiamo... Non appena riesce. Ok, analisi del ritmo.
Ok, entra una fibrillazione ventricolare. Ok. Allora, via tutti ragazzi. Carico.
Prendo una via aerea definitiva.
No.
Prendo la via aerea. Nel frattempo prendo la via aerea definitiva.
Riesce, Carlo? Ok. La pausa. Siamo nell'anestesista. Ok.
Okay, mind your anesthesia now.
Ok. We started with an asynchronous and we got the end
End title is in line.
We did CPR, analysis, it's different.
I'm trying to take
The end title is 1 year. It's starting to move a little bit. You just gave it. You just gave it.
Ok, analisi tra un po'. No, aspetta, vai. Vai, non è adesso.
He's starting to cough.
Abbiamo
Ok, rosso. Iniziamo su con l'elettrocardiogramma dove si ok, e ripartiamo per i valutazioni.
He's coughing a lot.
Nel frattempo somministro 0,1 unità pro chilo di insulina, glucosa da 10%, 5 ml chilo, 30 minuti. La glucosa da 10%, 5 ml chilo in 30 minuti. 0,1 unità pro chilo.
How much is that?
Ah, ok, 2,2.
Confermo che abbiamo solo un ritmo sensale e una saturazione della
Ok, allora vai.
Posso prendere una pressione?
Aspetta, dobbiamo la C. Passa bilateralmente, ok?
He's moving a little. He's moving a little.
100%.
Yes.
I polsi ci sono.
And Grandpa is upset. Grandpa is upset. What happened?
Non mi fai tranquillo adesso si è ripreso, lo stiamo gestendo.
What happened?
Cosa è successo? Allora, il suo cuore si è fermato. Ha ricevuto l'aria delle palle che stiamo leggendo, adesso lo controlliamo. Ok, quindi andiamo avanti.
Okay, let's time out. Okay. Okay, and then the recorder. Yes. Maybe you can just give a 30-second expire.
Ok, allora, un bambino di 5 anni con un'insufficienza renale in dialisi viene per un dolore toracico assetato, dopo le nostre valutazioni a 4 minuti ha perso il polso, aveva una fibrillazione ventricolare e shock.
So what is the headline? What is the situation?
Ok, pronto soccorso, siamo in pronto soccorso, bambino di 5 anni, arresto cardiopolmonare con un ritmo defibrillabile.
Do you see how different it is when she starts with the history of the patient compared to situation 5-year-old boy shockable rhythm, cardiac arrest. Okay. He has renal failure and hyperkalemia as the cause of the arrest. Now I have the picture. Now, with background, he's on amlodipine, he has this and that and the other. But when you start with the other, I can't let, and then you get to the end, he's in cardiac arrest. Wow, it's different from hearing the headline and then the story.
We get the attention of the...
Get the attention, and when I hear the headline, then I know how to listen to the rest of the story. But if I don't know the headline, I'm constantly listening. What is the story? What am I listening to?
And I can understand better with the right assessment, initial assessment.
Yeah. Okay. So go practice. Then we come back afterwards. Okay.
Thank you.
If I don't know any some words in
You
English.
can just go do whatever you want.
Yeah, no, I'm just alerting that some words might be in Italian.
It can be all in Italian. Doesn't matter. Okay. Okay. So we have, except for this part. We have a 5-year-old boy who comes with his grandfather. Unfortunately, this boy, Antonio, he's 5 years old, but a few months ago he had a kidney injury, kidney infection, and he required peritoneal dialysis.
Okay.
So he went home on peritoneal dialysis. He's been doing very well, going to school, etc. But this morning, he woke up very swollen, a lot of abdominal pain, chest pain, and he's very sleepy and tired. He's trying to eat his breakfast, and he doesn't look right. So the grandfather brought him into the hospital, and you're here in the hospital, and he's complaining about his belly and his chest, but he also is very thirsty. He wants to drink water. So he's coming and complaining, "Doctor, can I have some water? Can you treat my pain?"
Okay, Antonio is going to check you very soon, and we'll let you know if you can drink some water. Okay, guys, we have a 5-year-old.
He wants to know if he can sit up. Can he sit up? He feels better sitting up.
Baby, no, you can't now. I'm very sorry, but the grandfather is here. We're going to assess. Sorry, we're going to assess you very.
But I want to sit up and I want to drink some water.
I know, baby, your grandfather is here with you. Let's start with the PAG, guys. Let's put all of the parameters and let's get 2 IV axes pretty quick. The patient is anxious.
Yes, he's asking. He says, "Do you promise I can have a drink of water in a few minutes if I let you do this?"
Yeah, baby. I mean, we'll see. We'll see how you. But we're going to.
But you said I could have some water. I heard you.
We're going to have you drink from your vein in your arm, okay?
Oh my God! Never heard
PAT.
that before.
Aspetto generale.
Please, can you translate him?
L'aspetto generale.
Pale, very good and very swollen. Eyes are swollen. Skin is swollen. Arms, feet, and legs swollen. No rash, but just swollen.
Ok, il lavoro respiratorio?
He's breathing pretty easily. He's crying a little because he wants some water, but he's breathing about 40 times a minute. But not with any problem, just fast.
Did you manage to get the IV access?
I didn't see it. Did you try?
Yeah.
Yeah? Not the first time.
Okay.
Let's
So I try again.
Once we try, then we have a CBC and hemogas analysis.
Oh, you get the
and
IV now.
also the exams for drinking.
Yeah. Ouch, he says, when you put it in, but you get the IV in. Ouch, now can I have my water? My chest is hurting. He's complaining that his chest is hurting.
Let's give him paracetamol.
I got the IV access 3 ways.
Yep.
Okay, so I'm taking the exams.
Okay, yeah.
Ok, come sono le diete? Sarebbe mantenibili?
He's talking, he has a little bit of secretion, but he's breathing pretty easily.
Un po' di secrezione.
He wants to sit up. He says, when I lie down, I feel like I have trouble breathing, but when I can sit up, I can breathe much better.
Okay, let's have him a little bit sit up.
Yes, and now some water?
No, not maybe.
No.
Okay, let's prepare atropine and let's do the BCG, this evaluation.
Okay, baby. So we're gonna check.
Okay. now he's not complaining. Very sleepy.
Ora non si lamenta, è più sonolento.
He's not complaining at all.
Si lamenta.
What happened?
Oh my God, he's falling asleep.
It's okay, it's okay. We're going to take good care of him. Is he uncomfortable?
Okay, the thorax is expanding normally.
Let's put the pads, please.
Yes.
No.
Okay.
Guys, let's check the
Pulses.
pulses, please. Let's check the pulses, please. There are no pulses. Okay, great. Can we start CPR
Yes.
and ventilation with a sublaryngeal mask? Let's call the anesthesiologist. Can we have the hemogas analysis as soon as we can?
Yes, it actually just came back. Glycemia is 200.
200.
200. pH is 7.0.
Okay.
PCO2 is 50. Base deficit minus 20. Potassium 9.
Okay.
Sodium 130.
Okay.
Calcium is normal.
Okay, do you have it written down? Okay.
He's not on your team.
Okay, ragazzi. Okay, guys, la fibrillazione ventricolare let's prepare for defibrillation, please. The hyperkalemia. Let's start calcium chloruro. Okay, let's prepare calcium gluconate, please. What's the weight, sir?
22 kilograms.
22 kilograms. Let's use defibrillation 2 per kilo. Yeah, is that with Charles? As soon as we can.
So I'm paying calcium gluconate at 10%.
Yeah, let's administer calcium gluconate.
0.5 milliliters.
Yeah, guys, that's talking. Okay.
Okay.
And then let's start preparing insulin and calcium. Okay, let's try CPR. Let's prepare insulin and insulin and glucose saline solution 10%. Yeah, and era 200 di glicemia, era 9 di
È sempre fibrillazione continuare
Okay, well, in 3 minutes we're going to defibrillate another time, okay?
So I'm preparing insulin 0.1 milliliter kilo.
Yep. Let's call the nephrologist as well.
Yes. And glucose solution 10%.
Exactly. Yeah.
5 minutes.
As soon as the calcium gluconate is done, we'll start the insulin.
The nurse wants to know, she said, we just have a peripheral IV, not a central line. Can we give the calcium through the peripheral?
The calcium gluconate.
Yes, can you give it through the
Yeah,
peripheral?
in 10 minutes.
In 10 minutes.
Yeah.
Or slow in intrabone.
So what are you doing?
We're
putting in intrabone.
In intrabone, yeah. But ma la stiamo mixando non da quando abbiamo iniziato. Let's get an intrabone as well, but we have to administer that in the IV.
Over 10 minutes.
Over 10 minutes. Okay. Because we need to. Okay.
Sono passati 2 minuti che facciamo una
Yeah.
2 minutes
We're in, yeah, we're putting the. Let's also put the capnography, please. And tidal CO2, sorry. The mom, maybe, yeah, so that we can get better information.
Fingers down the tibia plate.
Can you come here, please? Can you come here, please?
Show me the needle.
Any other resource doctors that you would like at the bedside?
He's a nephrologist.
On the medial,
And then also this is
medial. Fingers down.
But show me where. Do it on this kid. Show me on this kid.
Mettilo su quel ginocchio. I'm going to go for extra rotation.
Yeah, anteromedial of the tibia.
Abbiamo controllato I polsi per vedere se la qualità della
How's the ventilation?
The ventilation is good, the first.
Okay, sorry, finish.
And then we take out the spindle flash for the test.
We also have the capnography, as I said. Thank you.
Capnography is in line.
Okay, guys, how much time left for next defibrillation? Let's also call the cardiologist anyways. Thank you. Yeah. Okay, can we administer something? No, okay. How much time, sorry, how much time left on the calcium gluconate? You're going to tell me if you're going to switch. Okay, like normal time. Okay, real time. 3 minutes. 3 minutes. Yes. Okay, then 7 minutes. Okay, no, sorry, I didn't know if you were going to skip time.
Right.
Okay, have we prepared the insulin?
Yes.
Okay.
Yes.
Let's go to the ICU and tell them that we have a patient around now is unstable.
Yes. Should I call?
The timekeeper will call the ICU and just tell them that we have a patient who is unstable. Okay. And
now you're in the ICU. He's the ICU. You can call. You can call him. Yes. Go ahead. Use your phone. Call.
She's calling. She
Back to back. Oh, don't look. I got you.
Okay. 4 grams per kilo. Let's prepare for defibrillation. Okay. Now charge. So let's continue the CPR and the ventilation while it's charging, please. It's charged. Everyone awake. Let's get the oxygen away. Yeah, you can go to perfect. Okay. Okay, we have rhythm. We have rhythm. Let's check the pulses, please. Let's everyone get their own.
He's starting to move. He's starting to move a little.
Okay. Let's get, yeah, exactly. Let's get the laryngeal mask away. Is he still unconscious or is he
still unconscious, but he's moving a little and coughing a little.
Okay, perfect. Let's put normal breathing mask, 15 liters per kilo, with presence 100% oxygen. Okay. Yeah. Let's give him salbutamol. Okay. Let's do the CABDE evaluation.
Okay. So the pulses now are presented, and peripheral and central ones. The heart ratio is 8 almost.
Okay, perfect.
Okay. How is the capillary refill? Capillary refill. 2 seconds. Okay.
I think the iris are here and
I'm sorry, I'm going to stop you there. Do we have any signs of preload?
What are you looking for?
Swelling of the legs.
You definitely have swelling of the legs.
The same as before.
Same as before.
The same as before. Okay, let's call the nephrologist and tell them that we're preparing furosemide. Yes. Okay. What's the pressure of the baby? Blood pressure. Blood pressure. Okay. Can we check the blood pressure on the parameters? Let's continue with airways.
Okay.
Okay.
Okay, let's go.
Okay, is he expanding normally in the thorax? Okay, 87 saturation. Are there any other sounds, lung sounds?
And he has Rouse. He has
Okay,
Okay, let's put CPAP, please.
Okay.
Yeah, and let's prepare the first amount.
Okay. The nurse notices that the pulse ox has disappeared.
Okay, guys, let's check the pulses again, please. Let's adjust the saturation because it's a little bit dislodged, please. Let's check again the saturation and the pulses. The pulses are present. Let's do.
Oh, now it's back.
Okay, the problem was the saturation. Okay, let's finish.
Okay, so the question is
okay, let's time out. Time out. Okay, good. Good.
Oh, all right.
Who's the recorder? Okay. Not right now, but just you'll be reporting when we go next door. Okay? 30 seconds. Thinking.
Okay.
Okay?
No. She will do that in Italian.
Yeah, that's fine. Yeah. Okay? Okay.
Thank you.
Thank you. Avete tutto? Non avete lasciato tablet? No.
Trouble breathing. He's, can you start, Fabio? Start. Strider, yeah. And he's having difficulty breathing. He wants to sit up and lean forward suddenly. And so he's really seems very sick, and he's working very hard to breathe. Okay. 5 years old.
Okay, 5 years old.
Okay guys, so we have this 5-year-old boy with respiratory distress. He's fine, don't worry. Now we take care about this. Okay, so Bea will take care about will be the timekeeper, and Bea will take care about the medications. Camilla will check the breathing, Lucy will check the airways, Gabriel will be at the monitor, and I'm the team leader. Okay?
Approximately 20 kilos, guys.
Okay. Hello Antonio, how do you feel? We are gonna take care of you, okay? So how is the appearance? How is the breathing?
He's going.
Okay, what about the skin color? Okay guys, so let's place another breathing mask, 100% of oxygen, and let's take a minute, like this. We limit them in the comfort position.
Yes, and put the pulse oximeter in the right hand.
Yes, 100% monitor. The airways are patent, are clean. Okay guys, so I think probably it's a group, so we should administer adrenaline to our isol as soon as possible. Okay? And 1 ml every 6 minutes.
Okay, so I think 2 ml of adrenaline.
Yes, please.
3 ml of physiological.
Yeah, exactly.
The airways are clean, patent. Okay.
The airways are clean.
Okay, okay. And what about the breathing rate? 40 breathing rate. I start with the adrenaline with physiological solution and nebulized. Yes.
40.
Okay. So, okay. Do we start the adrenaline through the aerosol?
Yes.
Now? Okay. So let's continue with evaluation.
Yes.
And we can place an access, so we can administrate the steroid through IV line.
Okay. The central pulse is 6%.
Okay.
Sorry, I just
And the peripheral is
85.
with the problems with the upper airways infections,
Okay.
I'm on therapy and against antibiotic therapy when gets pneumonia.
Okay. So guys is also he has also fever. Okay.
So I managed to take the IV line. Okay. So I'm preparing the methylprednisolone 1 mg per kilo.
And then we try to take a second IV line because I think we will need it.
I'm checking the blood pressure.
Yes.
I can't hear rumors.
You can?
I can't hear rumors in the
It's just the streeter.
It's just the streeter, okay? You are administering adrenaline, so it's fine.
Now I'm administering 20 milligrams of methylprednisolone.
Perfect.
Now, and then I'm trying the second IV line.
Okay, the pressure is fine. Okay, but
the saturation is not fine.
okay, so let's support him. With ventilation, back mask ventilation. I got the anesthetist because maybe.
The nurse wants to know if he should lie down or if he can sit up.
No, he can stay in most proper position. I called the anesthetist because maybe we need the endotracheal intubation.
Yes.
Can you take a second access?
I'm trying. Did I manage to take the second IV line?
I called the anesthetist.
If you want to call, then you can get on the phone and then anesthetist will answer.
I go to the corner.
Whichever you want. That's okay. How would you do it?
Yes,
Like this.
Nice, 100.
Hello.
86 still.
Did I manage to take the second IV line?
No, okay.
Did I manage to take the second IV line?
Probably due to a group. We already managed to
Good. Yes. And are there any signs of reload? No margin.
Yes, he's conscious, but really with
now I'm ready to pass the second IV line.
Why is the
With cruise?
Yeah, probably because for now we are not managing well the airways.
We are
now we are ventilating. Yes,
Okay, I'll be down in 5 minutes.
Okay, Martina, I've taken the second IV line and started the acetaminophen, and then the methylprednisolone started about 2 minutes ago. Do you want me to start to prepare sulfate magnesium in case 19? Okay.
Do you think asthma? 93,
but if you don't think so.
94 now.
No.
Or 95, but
Okay.
We can answer
The fashion is fine, the capillary fill is fine, it's 2 seconds.
Okay.
And we don't have signs of preload. So
no
it's
signs
not.
of preload, okay. You hear the...
And
becoming very sleepy.
Very sleepy.
Yeah.
The same is conscious.
He's not fighting you anymore. He's not fighting you anymore.
Okay.
But he's still breathing fast and slow sound.
Okay, so if you can put
Yes.
Let's put here.
So we are waiting the anesthetic, so probably we will intubate him, but now we have 12 for the hours, okay?
Let's do the neurological evaluation.
Yes, let's continue with the...
What did you do?
I put an nasopharyngeal because it's semi-consciousness for patting the airways and still ventilated him. Perfect. Let's continue with the evaluation of the drips on disability.
Yes.
What about the ABPU?
Okay, let's stop.
Okay.
Sorry.
Okay.
Brian.
Are you ready? Let's do a 30-second aspire to the camera. To the camera.
Okay.
Now come
Closer.
to the camera.
Okay, so we had the 5-year...
You want to do it in Italian or in English?
No, it's okay in
It's
English.
English, okay.
Okay, so we had a 5-year-old boy, approximately 20 kilos, who came for respiratory distress. We administered adrenaline 2 ml in aerosol, and then after that methylprednisolone intravenously. We supported the ventilation through bag mask ventilation because the saturation was not adequate. And then we administered also acetaminophen due to high fever. Now we needed to support the airways because of unconsciousness, so we put the nasopharyngeal device, and we need you to continue monitoring and support the ventilation.
Okay. What was the headline? What is this patient is? We need one phrase.
Respiratory distress progressing in failure. Obstruction after airways.
Respiratory distress, or say again?
Failure.
Okay. So you were saying respiratory distress progress to respiratory failure.
Yes.
Due to obstruction. Okay. All right. Go on. We'll do the other team, and then we'll have.
Yeah.
Okay.
Thank you. But we can do a picture together.
Picture together?
With you.
Okay.
We should do a boy who comes with his father, who is very concerned because his son is breathing very hard. And he's breathing very hard, and he's really concerned because now he's really starting to turn blue and very uncomfortable. So we bring him to the emergency department where you are to evaluate him. And he's saying, Antonio, don't worry, the doctors will take care of you. Come on.
Okay.
Come on, be okay. Just take care of him. Yes.
Okay, so my girl was named
His name is Antonio. Yes, but he's doing
conscious. Can you check the vibration? Can you check the status?
He's having trouble breathing.
Yes. I think the voice while motion.
Yes, he wants to breathe better. Yeah, he wants me. He wants me. His father. The father, no, I can't leave him. He's been in the hospital 3 times in the last month. He was a premature infant. He was intubated for 6 months. And he couldn't breathe except for the ventilator. Then he came home. He's grown so well. But now every time he gets a cold, he starts breathing like this. Oh yes, he's on salbutamol, aerosol. He's on prednisone, some drug for his asthma. Also, he has allergies to antibiotics like penicillin. Oh yes, he's four times on the way to the hospital. Yeah, it's not. He's breathing differently. It's not like his asthma. It's like
He was when this happened.
See, just this morning, suddenly, after having a cold last night, he went to bed. Okay, I thought he was going to have asthma when he woke up, but this morning he's breathing very differently. And he wants to sit up. He won't lie down.
Yes. Sure, we've got to find out what the child is we dedicate the generator, and let's comfortable position, and then let's start with the oxygen breathing mode.
Meanwhile, the saturation of the oxygen is exactly 60. Okay. So
That means we're ready to speak fast.
What time is it now? No, 1:07, 1:08, 1:09. It's not making any difference. I came.
Yes.
Okay, never had similar things. Ha avuto febbre da ieri, si è svegliato stamattina con questa difficoltà, è asmatico, ha fatto già 4 volte la terapia è migliorato e non ancora trattato, è un prematuro e quindi ha avuto sempre le difficoltà respiratorie e infezioni
He's almost in a paradox of breathing. He's like really retracting.
Okay. And have you done
Yeah, how is breathing time? 2 seconds, okay. Is that right for this time?
No, but it's hard to tell because his belly is coming in and out.
Okay, I understand that the present, but the chest, the breathing is almost undetectable. It's really low. Refill time is 2 seconds, and I think there is no sign, but it's difficult to...
Okay. The pressure is 100 on 60. And the rhythm is tachycardia, but rhythm is sinusal. Saturation is 79%. Respiratory rate is very tachypnea 60.
I start working in 100% oxygen, 24 minutes.
Now if you...
Can I ask what medications have been given? What medications have been given? Nothing.
Is there anything on his body that's
He's upset. He's moving around. He hates this.
No rash, no injury.
Okay. So
Hair and the clothes are a little bit blue. And the fingers are a little bit blue. And the mouth
Okay,
is
so let's start with adrenaline in or
aerosol. Okay, adrenaline solution 1,000, 0.1 ml per kilogram, so 1.5 ml. 2 milligram of budesonide and 1 ml of isotonic solution, all in aerosol. So like.
Go ahead. Is there an aerosol there to give it?
I put it this.
Okay, thank you.
I put it this here. And I give us oxygen.
Okay. And how is his glycemia?
Did they send that?
No, glycemia with the...
Glycemia with the finger? It's 200.
Okay.
Temperature is 58.
Okay, so, vaccinato, non mi ricordo del
Sì, vaccinato.
Okay. So, yes, we've got a child with, we don't know if it's a crop with an upper airway obstruction, a 5-year-old. Can you check the pupils?
Yes, our pupils.
Still retracting though. Still doesn't look at here, but he's still.
Pupils are big but reactive.
Okay.
6 millimeters to 3 millimeters.
Okay. So, and meanwhile, Federica managed to take this access.
Yes.
Okay, let's start
with the exams, with the even hemogas, hemochromo, all electrolytes, and an hemoculture since he has fever. And let's put even a 3 EV line in his access, and let's start with the betamethasone.
Is 89% now, it's hypotonic, and the pressure is super high.
Okay, so since we are not, it's going better also. Okay, so since we are not capable to manage the airway, we may evaluate to sedimentation to bag him, or we already called the anesthetist, and now we called even.
Did you call the anesthetist?
At the beginning, when we saw the edema, because of the difficult intubation and difficult airway, and another.
And what do you call back? Because the anesthesiologist changed, they want to hear whether they need to come down.
Okay, can we tell you the difficult intubation? And we even pre-alert to the otorinoolaryngoscopy, because he may need even a tracheotomy. So we have started with this.
The nurse wants to know. The nurse wants to know if you want him to lie down or if he can sit up.
If he prefers to stay,
for the moment he prefers to stay.
Okay, let's keep him in the way. We need to keep him in a comfortable position. If the father wants to try to return we can go in there. We would like arterial hemogas, but it's better if we don't try to educate him. So let's avoid it. And let's do something for fever. So let's give him another paracetamol. Okay, let's
become very quiet.
Okay, let's
become very quiet.
Let's check.
Does it respond to verbal stimulation?
He's not responding
to pain stimulation?
A little bit to pain.
Okay, so let's down and
Hey guys, I can action saturations median.
Mr. Nichols.
I can
Okay, it's not, don't worry. Let's put the rigid table. Now can you put the chat? Okay.
Okay, don't worry.
Okay, I can feel the pulse.
Okay, there is the pulse. Don't worry, it's not nervous. But let's first of all,
let's start.
Okay.
Now we're going to go next door.
Okay.
We'll have an S-bar.
Okay.
And then good thing and something to
Okay.
Years old. And the grandfather is bringing him in because this morning he's been very sleepy and he's developed a fever and he's an oncology patient. He has leukemia and he's under treatment for leukemia. Okay. Comes to this hospital very frequently for his treatments. Okay. And so he was told if he ever has a fever or if he's ever acting sick, you bring him right to the hospital. Okay. So he's bringing him in for that reason. He's awake, he's feeling lousy and very sleepy.
Okay.
Ragazzi, avete sentito tutte, io faccio il gym leader, Gio timekeeper, Giulio farmaci, racconto compressioni, Gilda Vere e ci monitor. Mettiamoci la mascherina con il compromesso e I guanti. Ok, I just want to know stai respirando così perché ok?
He's breathing better, and he's saying that he's just very tired and he's breathing about 40 times a minute, fast, but easily.
Ok, com'è il suo colorito?
Skin color.
Ok.
That's his skin color.
Ok.
He asks you if you can use his other arm because his catheter is on that side. He has a central line port, and it doesn't feel good to have the blood pressure taken on that side, he says.
Is he going to be okay?
Okay. Yes, Giorgio, per favore, vai dal nonno.
He's also very thirsty, but he's also feeling like he's going to throw up.
Ok, chiediamo se per favore la funziona come ha avuto problemi.
Allora hai sentito? Senti anche la distanza fatto?
Allora, biere Perbia.
Yeah, I just not feeling good. I just want to go to sleep. And I just go to sleep, and I must have I'm really, really hot.
No, ok.
No.
Ok,
What are you doing to my throat?
Quindi faccio come funziona con l'accesso veloce.
It doesn't feel good when you do that.
Ok, allora, io devo scrivere il corso quali? Dal lato del catetere? No, dall'alto, ok. Devi apro una maschera non breathing 10 litri al minuto. Ok, usando
70 su 29 di pressione.
Ok, 70 su 29 di pressione, abbiamo detto che ha 5 anni, ok, 5 anni, quindi se siamo per favore.
Tempo il CVP, riesco? Ok, voglio esaminare il CVC, come fare la conduzione intorno al CVC?
It's a little difficult. The dad says he does a really good job of cleaning the site. He noticed it's a little bit red recently, so he's doing extra cleaning. And the catheter has gotten more hard to push, but it still flushes.
Okay, I'm gonna try another ok, provo un altro accesso venoso periferico, io non userò quel CVC messo qua, e sicuramente passa il passo. Prima devo mettere l'accesso. No, non sono riuscita. Tento un altro salire, mettiamo il braccio. Riesco il secondo accesso?
Aumento a 15 litri minuto e prendo una maschera.
The first time you tried, he said ouch, and this time he's not saying
Eleonora, la seconda volta che ho provato a mettere l'accesso non ha funzionato.
Avevo aumentato a 15 litri al minuto l'ossigeno. Sì, gliel'avevo messo prima, 15 litri al minuto.
He's conscious. He wakes up and groans and cries and tries to get you away and then he falls asleep.
No, non sta gridando, cioè lo sentiremo gridare.
No, per mettere le grosse, ancora sveglio.
Ok, no, fai subito.
He's not yelling, but he's groaning and singing and uncomfortable, but he's just not.
Okay.
He says he feels like he's going to faint.
Okay.
I'm trying intractive.
Okay.
I'm trying intractive access.
He doesn't like it. He kicks you down.
Okay.
The nurse says, "Can we use his Hickman? He has an IV. Can we use it?" The nurse says.
Ok, inizio a ventilare un pallone alto.
He doesn't like that. He's losing away. He doesn't like it.
Okay, I'm trying the CBC. Can I take and put something in the CBC? Does it work?
You can flush.
Okay.
It's a little hard, but it flushes.
Quindi fai un volo da 10 ml per chilo di capillare.
5 seconds.
Ok, 5 secondi. Un volo da 10 ml. Sentiamo per favore i segni di
Ci sono segni di frequenza, è stato splenomegalia.
Chiama l'animatore e avverto per favore che io ho rimesso 15 litri al minuto di
If you're going to call really ask
I'm gonna put some sterile balls. I'm gonna open the CBC and I'm gonna put 200 milliliters.
Hello.
I'm gonna put some sterile balls. I'm gonna try to do as clean as possible. I'm gonna open the CBC. Does he have 2 lines in the CBC? Does he have 2 lines? Okay, perfect. Okay, so I'm gonna put 200 milliliters of sodium chloride in 10 minutes. And then I'm gonna draw. Okay, so I'm gonna draw some exam from the other line. I'm gonna do that.
Can you take hemochrome, so blood count, as a renal function and immunoculture, PCR, RCT, reactive protein?
procalcitonin, and also ionogram.
So you're saying if you do a bedside glycemia, it's 200.
Okay.
200 glycemia, okay.
I'm gonna send the exams that she just said.
Okay. Aggiornatevi avevo l'evidenza per la ventilazione per una desaturazione, non la tolleravo, ho rimesso 15 litri al minuto di non rebriefing, la saturazione va bene. Quindi siamo 15 litri di non rebriefing e ancora tachipnoico. Ragazzi, siamo di fronte a un paziente scioccato, in shock ipotensivo, abbiamo sul primo volo e probabilmente potrebbe essere secondario di uno shock settico. Non ha allergie, è un paziente neutropenico, per cui prepara per favore del ceftriaxone 1 grammo al chilo dopo che hai prelevato gli esami.
Gli esami sono già partiti.
Perfetto, ok. Adesso abbiamo sul volo, lo controlliamo quando sta per finire, però mettere un secondo accesso. Ok, continuiamo la valutazione.
Ok, la fare?
Sì, metti socializzazione sulla seconda via.
Ok. C andava bene, semplicemente refilo allungato, non si deve fare tanto poco. Come le estremità sono calde. Cold, ok, anche perché il refilo allungato, polso nel centro. Come livello di coscienza?
In and out.
In and out, ok. Le pupille?
Equal and reactive.
Ok, e c'è rigidità locale. Ok, e poi vorrei fare un destro stick. Scusate. Ok, e come diuresi? No, vabbè.
Possiamo chiederlo al nonno se in questi giorni.
In the meantime, I have 2 grams of ceftriaxone. Is not that it doesn't find it. So I have 2 grams of ceftriaxone. No, in 30 minutes. Okay.
Allora, sì, intanto metti il catetere vescicale e prepara della tachipirina 15 mg per chilo.
Sì, dovrei mettere una sponda nella
Sì,
probabilmente una mettere l'ultima fila stamattina. No, gonna put vesical.
Just a little bit. 2 ml.
Allora glielo chiedo semplicemente. Lo giriamo per vedere dietro se sono presenti i petecchi.
Normal. He has a few petechiae, a few.
Petecchi.
A few. But his father says after chemotherapy, this is what he sees us very frequently. Oftentimes he needs some blood transfusion or platelet transfusion 2 weeks after his chemotherapy.
Ok, raggiunto, scusami,
Però c'è pulito.
Quindi sta iniziando a saturare francamente tachicardico. Abbiamo fatto l'incisione del polso, mettiamo l'incisione del derivazioni per valutare il ritmo e imposta per favore la pressione.
Certo, ogni minuto.
Ok, grazie.
L'ultima era una lezione delle 30.
Sì, super sinusale. Ok, abbiamo chiamato il rianimatore? Sì, ok,
sta arrivando.
Quindi ragazzi, grazie, scusa. Quindi ragazzi abbiamo un paziente, ricapitolando, sospettiamo che sia un shock septico, un bambino di 5 anni, 20 kg abbiamo calcolato, ok? Che aveva un'iniziale era uno shock ipotesi, abbiamo su il volo, giusto? Sta sviluppando segni di precarico, quindi puoi valutare per favore durante il volo.
Segni di precarico durante il volo.
Ok, è stabilmente ipotesi, se propone. Ok, va bene, prepariamo il secondo. Abbiamo su ancora il volo, da quanti minuti abbiamo sul volo?
L'abbiamo messo in 10 minuti, è su da 7 minuti.
Ok, stiamo per finire il volo, preparane un altro per favore se non è fisiologica.
Okay, let's time out. Okay? Okay, so now we're doing this part over there after the other 2 scenes have had a chance to. Good?
Thank you.
Okay.
Thank you.
Good morning. Dad is here.
Oh, what's happening?
So this is Antonio. He's a 5-year-old boy who has leukemia, and he's been on chronic treatment for leukemia.
Okay.
But his father is bringing him in today because he was told he developed a fever this morning, and now he's very lethargic and not feeling very good.
Okay.
And so his father was told if he ever has a fever or if he's ever acting sick, bring him right to the hospital.
Okay.
Okay, so your father is here. He's brought him in. He's awake. He's talking to you, but he says, "I'm sleepy and my stomach hurts."
I'm Tommaso, the team leader. I have Marcus, timekeeper, and Vanessa to the drugs, Chiara to the monitor, Julia to areas, and Lorenzo to the evaluation. As a quick look, so he's speaking, right?
He is speaking, yes, but he's tired. He keeps on
tired.
falling.
Okay, does he have a lot of vocal breathing?
He's not working hard, but he's breathing a little fast, maybe 40 times a minute. Like.
Okay, so
But he's not
okay. The color is it pale?
Looks like
ok, perfetto. Chiara ti chiedo di mettere tutti i monitoraggi, cominciamo la valutazione, Giulia mi valuta gli altri. E magari lo mettiamo prima, gli togliamo.
He doesn't really want to lie down.
Okay.
First he's
We prefer to stay up. Okay, allora lo teniamo
So he says that he's also getting a headache. He doesn't like it when you put your hands. He says, "It's hot. Don't put your hands on me."
Areas are clear. I see secretion, vomits, or something. Are clear. Okay.
It's dry. Actually, it's a very dry mouth.
Okay. And put him in his comfort position.
Yeah, every position is uncomfortable. He has a headache, he has a stomach ache. He also asks you to be careful because he has an access, he has a cord, and it's access, and actually his what is here, because it's kind of hurting, so he doesn't want you to touch his shoulder.
I put another breathing mask with 100% oxygen at 12.
There's a mask.
Perfetto,
Breathing 12 liters per minute.
I'll proceed with B. Is the expansion of the thorax symmetrical?
Yes, it seems so.
Okay. Do I feel any air trapped beneath the skin? Okay.
He doesn't like it, sir.
He doesn't like it when I touch here.
Ragazzi, ricordo a tutti, se qualcuno non ha capito, che lui ha un forte che gli fa male.
So any signs of distress that I can't see, like beneath the ribs?
Fast, but not
just fast, but no signs of distress. Okay. I'll proceed with auscultation.
Last night.
Last night, okay. And the event so
he says he's feeling a little bit like he's going to pass out. It's very weak.
Dici il sample?
Allora, adesso è la leucemia, la porta qui perché ha la febbre, non risponde al paracetamolo perché si sta in casa, ha fatto 3 settimane fa la terapia con steroidi, che è quella che fa
Ragazzi, state saturando? Ok. Is it responsive?
He's still responding like groaning and moving, but he's a little less responsive. The nurse noticed that the pulse ox is gone.
Okay.
Does he tolerate?
We get that?
No.
No. Okay.
Yeah, he wants to know what's going on, why are you doing this?
allergie, il tuo passo di sera ha urinato molto poco e non vuole più solo con la febbre.
Ti chiedo adesso per il suo accesso perché il porto che ha gli fa male.
Can I take the blood pressure manually?
Yes, it's 60 over 30.
We take another axis because we don't trust the port that he has.
Sorry.
We are not able to. Not even the second one.
No, but the central line catheter is a little stiff, but it works. You can flush and you can draw it. But the nurse is asking, should we use the central line? If you think it's effective, should we use it or no?
No, togliamo un altro accesso.
I retried another peripheral vascular access.
Sorry, it's very difficult. The father says they can never get an IV in, and that's why they put the port in.
Ragazzi, facciamogli un introsso con della ketamina intranasale prima perché lui risponde al
He
dolore.
starts kicking and says, no.
Okay, I use a ketamina intranasal. I assume that his weight is 20 kilos, so I use 20
The
micrograms.
dad says he's 22 kilos at the last clinic visit.
Okay.
22 kilos.
So 22 microgram of ketamina intranasal.
You have to draw it up. You have to get it.
I have it.
You can find it, yeah. And then how many mLs?
Facciamo fare il polso. Ricontrolliamo il polso che non vedo la pressione.
centrale presente.
Ok, saturation.
Ti riferisci con uno secco?
Sì. Allora, 5 minuti. Ragazzi, appena abbiamo successo, gli mandiamo gli esami.
Yeah, he's waking up. The pulse ox is back now that you readjusted it. He had kicked it off.
Okay.
And now it's still a little low.
Okay.
And his blood pressure is here.
Okay.
Before the ketamine. No ketamine given yet.
Okay.
And he's waking up and he wants to sit up a little more. He wants to sit up
Proviamo a farlo sedere.
Sì. Ok. 20 mg di ketamina dall'accesso centrale perché non sono riuscito a prendere quello per tempo. 20 mg di ketamina. Sì. Perché non sono riuscito a prendere l'accesso. Mi metto i guanti, metto il piedino, disinfetto l'area.
You gave 20 milligrams intranasally.
No, I use the central line.
Central line, you got 20 milligrams. Okay.
Disinfetto, provo a prendere un'intraossea.
Yes, I always say.
Ok, faccio partire emocromo, emocultura, elettroliti, funzionalità equatorenale, propacitonina PCR e un emogas già detta venoso e somministro 400 ml di soluzione fisiologica in 10 minuti. Metto anche un rubinetto 3 vie. Non ce l'ho perché faccio finta che ci sia un rubinetto 3 vie.
Allora,
in what? How is she giving?
I have 3 lines rubinetto 3 vie e somministro una soluzione salina 400 ml in 10 minuti.
And how is by the bag? The bag is running?
Yeah, it's in the bag, yeah. I have a pump also.
La pressione sta
scendendo, già Lorenzo ti chiedo di valutarmi la cina, nel frattempo Vanessa si vuole preparare anche il rocepin nel sospetto di uno shock septico.
I'll proceed with the evaluation of C. I'll proceed with the evaluation of C. Peripheral pulse is not
really
present.
Weak, very fast.
Very weak. The central pulse is present. I feel it.
Present, but very fast.
Pressure is as I see it, 60/20. Okay. Listen to the heart sounds.
Nel frattempo, visto che la pressione
very rapid. Very rapid.
Any turnover of the ejectors?
No.
Any sign of preload? Do I feel the liver drop? No, nothing. Okay.
Saturazione buona, allora aumentiamo il bolo a 20.
È già 20.
È già 20, allora mettiamo il catetere.
Faccio finta che sia un catetere, gli metto un catetere urinario.
2 analysis in the bladder. 2
analysis.
Come parte della Cina, temperatura ancora 39.
La temperatura è ancora 39, gli facciamo un paracetamolo, ce l'abbiamo nel cesso libero.
Sì, ho un metro previo solo il volo su
e solo il volo su, allora gli mettiamo il paracetamolo e anche un'adrenalina in continuo perché la pressione resta bassa.
Sono quasi 8 minuti, quasi 2 minuti dall'inizio del volo.
Adrenalina? Nell'altra linea do 330 mg di paracetamolo e V. Nell'altra via ancora do l'adrenalina in continuo, tirata 1 a 100.000, 0,22 microgrammi.
Ok, perfetto. Procediamo con la D.
Okay,
adesso ho 3 linee occupate.
Okay. I'll proceed with the evaluation of D. In the ABPU scale.
Time out there.
Yes.
Okay. Good. So next we'll do a SPAR there, and then one more team to improve. Okay. We have one more team to do the same. Yes. Ready? Okay. So we have Antonio. Antonio is here, a 5-year-old boy who has leukemia, and he's been on chemotherapy. He's been at home, coming back and forth to the clinic for his treatments. Been doing pretty well, but this morning he developed a high fever, and he became very sleepy. And his father was told, if he gets a fever, if he is acting sick, bring him right to the hospital. So he did that. He didn't want to come, but his father brought him. So here he is.
Let's prepare. Calling Antonio with leukemia. He has fever, so Cristina used to get airway, Alessia circulation, Francesca medication, Vincenzo you monitor, and Maria Pieta fever, and Firenze to stimulator.
He's saying now, I'm
So the patient
having
is
a
conscious.
headache. He says, I'm having a headache now.
Okay,
Can you give me something for that?
Antonio, okay.
Yeah.
Can he
Yeah, he says,
talk to you?
He said, I just feel very sleepy and I'm just very tired.
Okay.
My head
Can we hear
hurts.
any audible sound? Like from breath or increasing
No, I'm
of
just
breathing?
breathing fast, like 40 times a minute.
Okay.
I feel like
What about the color of the skin?
the tragedy is pale.
Okay, so let's apply.
But you know, I've gotten some dots on my skin. But I usually get that about 2 weeks after I get my chemotherapy. I get some.
Does he already have venous access, like central venous
Oh
access
yes,
for the
I
chemotherapy?
have a port that's accessed, and actually it's my catheter is here. But please don't touch my shoulder, because my shoulder is very sore, and I don't like people to touch my shoulder, and I don't like the blood pressure cuff on this side. Can you put the blood pressure cuff on the other side?
On the left side.
The right side is. Don't put it on this hand. I don't like it there.
Okay, so apply the multi-parameter monitoring, take another venous access if you can, and also maybe put the patient in a comfortable position where he's get off bed.
My head is more comfortable. Yeah, that feels better. Thank you. But I'm very thirsty. Can I have something to drink? But my stomach is
So
upset.
we're taking the venous access. So start with the evaluation from the airway, Mattina, please.
Okay, the airway is patent. There are
He's talking to you. There's no secretion. The back is very dry.
Okay,
And the cracked lips. And maybe a little bit of blood on the side of the lip where he's bleeding. That's tiny bit. But this happens all the time when he has his chemotherapy.
Okay, so a low saturation, sinusal tachycardy, and the respiratory.
What about the pressure?
Can I take it?
No, sorry, it's unsuccessful. But he says, why are you sticking me? Because my doctor told me I didn't have to get any more IVs. I have a line.
Okay.
They always draw my blood through my line.
Okay, so okay, with the blood pressure. Okay, so start with the evaluation, Alessia, with the breathing and the circulation, there is the blood pressure, and also have the patient with ha premuto, io ho premuto. We already touch again.
You already did another I applied the mask.
Thank you.
Okay, there are no abnormal sounds at chest. There are entries bilateral, earphones, regular.
So 70 over 40. 70 over 40. Yeah, 70 over 40.
70 over 40. Okay, so guys,
70 over 30. Sorry. Keep on.
So the patient has fever, low blood pressure. What about the issue you have perfusion?
I checked.
Okay, so the patient.
The peripheral pulse is.
You have to check on this matter like that.
Okay.
On the left side.
Okay, so patient guys should have septic shock, because patient has fever, and also signs of tissue hypoperfusion because he has low blood pressure. So from the central venous access, that is working, right?
It's a little bit stiff, but it can flush and you can draw blood.
Okay.
But the father says that it's become a little harder to push than usual.
Okay. Okay, so from the venous access, take blood sample for analysis, hemopulsar also, and follow from the catheter, so we want to know if there is an infection of the catheter or infection of the and also perform fluid because he has low blood pressure. We are also administering oxygen to decrease the remember the decreasing of saturation.
It's very cold.
Other radicular signs, extension of jugular vein. How does it weigh?
Dad says 22 kilos at the last clinic visit. About 2 weeks ago, he was 22 kilos.
Okay, I started with the paracetamol for the fever and with the
How much volume was that?
What about the last paracetamol?
This morning, so and also 400 milliliter of
Okay, so we are performing also a blood gas analysis. I want to know about sodium and potassium. Don't forget that the temperature of the
patient
patient
comes back with the glycemia 200 for the blood sugar.
200, okay.
Yeah.
Which is a reaction of the temperature. Don't forget the fact.
flight?
Yes, about 5 to 3 millimeters both sides.
Okay.
Equal.
Can I receive also?
Yes, yes. Thank you.
Are there any
No.
neurological signs? Can you move all the extremities?
Right, he can, he's moving all extremities, but now he's much sleepier.
Okay.
And he's groaning, but not really answering the questions.
If you are presentation, can we see anything? Like
Yes, just some petechia, petechia, but no other injury or.
Let's prepare also certe persone. We are already from not compensating septic shock, so think about certe persone. Also, we are waiting for the sodium and potassium because in septic shock we can have also hypoglycemia and
sodium comes back.
other especially patient that is doing steroids. So look at sodium and potassium when we have blood gas analysis.
Sodium is 125.
What sodium?
Sodium 125. And potassium is 5.5.
Okay, so we have hyponatremia. The pH.
pH is 7.3.
7.3.
PCO2 is 45.
Okay, so potassium 5.
Sorry.
Potassium 5 points. Sorry.
5. What did I say? 5.5. 5.5. Sorry.
Okay. So we have a patient with fever, fatigue, hyponatremia. The potassium is in limit, but very close to the upper limit. So consider the adrenaline insufficiency. Also for the story of leukemia and the fact that he takes steroids. So think about the hydrocortisone. Have you administered ceftriaxone? Okay.
And now he's very quiet.
Okay, so
he's sleepy. He's not complaining.
Okay. So the central part. Okay. So we are also continuous what's the pressure.
100 milligrams per kilo.
Okay. Also administer steroids. Okay. What do you think guys about the adrenaline? Especially we have patient with the story of fatigue.
Okay, blood pressure is
okay. What do you think about the hydrocortisone? Okay for you?
Yeah. Yes, 50 milligrams. I will give.
I want to tell you that the father tells me that the last capillaries are
Is the resting time improving?
He's not doing it.
The resting time is improving?
There was no
Okay, the period signs are not no period signs.
I will give a
15 milligrams.
Okay.
Però the resting time is 15 words and 7 seconds.
Okay, let's go also the intensive care unit call. And also if you can have a call for the oncologist that follow the patient. So sinus tachycardia with the saturation in range. We are checking the patient. We also administer the hydrocortisone, right?
Yes,
50 milligrams.
And also foods for the septic shock.
Okay.
Okay,
I will make it.
Okay.
Okay, hold on. Okay? So now we'll go next door, we'll do an S-bar, a good thing, and something else.
We have like 2 minutes, just
2 minutes.
Yes, yeah. But you'll also be the third group to do the presentations, so you'll have a few moments.
2 minutes, go on.
All right.